have been models for the blending of public service and the practice of law. My goal today is to offer some ideas about how law and lawyers might contribute to one of the greatest challenges that our country now faces. Our healthcare system is fast becoming the physical equivalent of global warming. Even as Americans lose their jobs and their medical coverage at an alarming rate, yet to be calculated. We've been losing more than 500,000 jobs per month, and we don't know what that means in terms of loss of health insurance, yet to be calculated. Even as the number of people in our country without insurance closes in on 50 million, we're on track towards spending 50% of our gross domestic product on medical care before this century comes to an end. So says the Congressional Budget Office, which points out the obvious, that we're not really going to spend 50% of our GDP on health care, that something big will have to change and will change. We're going to somehow bend the curve of rising costs downward in a major way. The question I want to raise today is, can the law that governs health care provision help us to do so without leaving tens of millions of people behind, without access to a decent minimum of medical care, and without cutting back on care senselessly with little regard for comparative clinical benefit? Standard wisdom holds that health law is ill-situated to do so, that health law is part of the problem. American health law today is a chaotic and incomplete patchwork created by 50 state court systems, 12 federal circuits that act in disconnected fashion, only rarely overseen by the U.S. Supreme Court, 50 state legislatures and sets of regulatory agencies, and, well, you get the picture, a scheme of chaos. Multiple doctrines are at war with each other, and core values are in sharp conflict. And there's bitter disagreement over the basics of what health reform should aim to accomplish. And this disagreement has paralyzed our politics. Yet commentary on health law typically presumes the existence of a few key decision makers who somehow can exercise top-down authority over the law in their domains, authority that they can wield, we imagine, to impose a single overarching vision. Consider the writing that you've often seen about health policy and law issues. Our health system should do this. We should do that. We should have a single-payer system. We should have a privatized, consumer-directed system, as though the other views and values and institutions didn't exist. And my central claim is that this kind of commentary, whatever the ideological perspective it represents, that this kind of commentary overlooks healthcare law's central dilemma, its astonishing degree of fragmentation. Rather than railing against this fragmentation, rather than calling for some imagined actor to fix the problems in top-down fashion, health law scholars and practitioners need to come to terms with the field's fragmentation. To this end, I'll offer some thoughts about how aspiring reformers might try to navigate this fragmentation and perhaps even turn health law's contradictory impulses toward reformist ends.